of rapid test kits and signed deals for hundreds of millions of doses of 7 vaccine candidates. Canada now has the most diverse portfolio of any country for vaccines. We're in the right place to have access to safe, effective vaccines as soon as possible. As the co-founder of Moderna, said over the weekend, Canada was among the first to pre-order their vaccine doses. We are guaranteed some of Moderna's first batch if the vaccine is safe and approved. Already, Moderna has submitted their candidate for Health Canada review, as have Pfizer-BioNTech and AstraZeneca Oxford. And just yesterday, Johnson & Johnson joined this list as the 4th candidate for Health Canada review. As I outlined on Friday, our government is also working around the clock with the provinces and territories and through the new National Operations Centre on the vaccine rollout. We've invested in everything from freezers to needles to be sure we can reach every Canadian who wants a vaccine, no matter where they live. On se tient prêt.
We are ready to distribute the vaccines as soon as possible. But before reaching that point, currently our absolute priority remains to flatten the curve and to save lives. That is why we continue to buy pieces of personal protective equipment and to ship them to frontline workers. We are also working to build our screening capacity for the provinces and territories. Over the last months, we have signed agreements with several top-tier manufacturers to acquire up to 40.5 million rapid screening tests. More than 5 million of these tests have already been distributed to the provinces and territories, and the others will follow. During the second wave, these rapid and precise tests are critical in terms of protecting people and slowing down the spread of the virus. They are particularly important for rural and remote communities where access to nearby labs is limited. As well as screening, we are allocating more funds to modeling in order to better follow and understand the spread of the virus, and in this way help communities to stay safe.
8 of every $10 spent in Canada to fight COVID-19 and support Canadians has been spent by the federal government. This includes the investments we've made for PPE, testing, and vaccines. It also includes the historic measures we've rolled out for families, small businesses, young people, and seniors. These are programs that you've relied on to help get you through this crisis, to help put food on your table or afford your rent, to save your small businesses, to keep your job, to make sure we make it through as best as we possibly can all together. In the second wave, you may still need that support. We all remember what happened when the previous government cut support too quickly following the 2008-2009 recession. That will not be our approach. We'll continue to be there for the middle class and those working hard to join it, whatever it takes, as long as it takes, until we get through this pandemic. Today, we saw new data released by Statistics Canada that shows significant economic growth over the past few months. This goes to show that the investments we've made in Canadians have helped families and businesses stay afloat. There are still tough times ahead, so we'll continue to be there for people, especially those who are hardest hit by this crisis.
We all remember what happened when the previous government cut support too quickly during the 2008-2009 crisis. We will not do that. We will be here for the middle class and those working hard to join it. We will do everything necessary for as long as necessary. The autumn economic statement tabled yesterday by the Deputy Prime Minister outlines a range of new measures that we will be taking in order to help Canadians during this crisis. For families with children under the age of 6, we will boost the Canada Child Benefit with temporary support up to $1,200 more. For youth, we will eliminate interest on student loans for a one-year period. For small businesses and their workers, we are going to strengthen the salary subsidy. For farmers, we will invest $2 billion more in order to help dairy, poultry, and egg producers who are subject to supply management. We will be there for you, your family, and your community during this second wave. Together, we will get through this, and together we will emerge stronger than ever.
On the horizon, the end of this crisis is in sight. And that means it is time to take a look at what's coming next. We have an ambitious plan to rebuild a strong, resilient economy that works for everyone. To help get there, our government will introduce a historic and appropriate stimulus plan of 3 to 4% of GDP. This will be a significant investment to get our economy back on track, and it's an investment that will make sure that no one gets left behind. We need to address the very real gaps this crisis has laid bare for women, for Black and racialized Canadians, for young people, and for Indigenous people. Because we are all better off when everyone can contribute to their full potential.
Through sound and targeted investments, we can rebuild a Canada that is stronger and fairer. We can invest in climate measures such as upgrades for residences and for energy, which promotes creation of good jobs for the middle class, as well as the establishment of a competitive and clean economy for the years to come. This crisis will not last forever. The plan that the Deputy Prime Minister tabled yesterday relies on a solid financial position and outlines responsible measures with which to move forward. We have experienced a difficult year, and the months to come will also have their problems. But we have a plan to help Canadians get through this crisis and to build a better Canada that will be stronger for all.
The fall economic statement we presented yesterday is our roadmap for the path ahead. But our response to this crisis doesn't end there. On that note, I can confirm that our government is providing additional support to 2 more communities facing very serious local outbreaks. To begin with, the Canadian Red Cross will be providing assistance to the government of Nunavut to control the spread of COVID-19 and keep people safe. For the community of Arviat, the Red Cross is deploying specialists on the ground, as well as providing rapid testing support at the Winnipeg isolation site before people return to Nunavut. We've also approved a request for assistance for Hatchet Lake First Nation in Saskatchewan for the Canadian Rangers until at least December 26th. Along with members of the community, the Rangers will be there to help with everything from health services to support for elders. When we invest in support for communities and for local organizations, we invest in Canadians. I think of the story I shared back in March about Samaritan House in Brandon, Manitoba. Thanks to the funding we provided in the spring, Samaritan House was able to extend the hours at their shelter and stock up their food bank. Today, I was told that they are now expanding their programs to reach even more people in need. Whether with funding for shelters, new support for small businesses, or investments in vaccines, we've got your back. There may be tough days ahead, but together, we'll get through them. On a tous un rôle à jouer.
We all have a role to play in the fight against COVID-19. Regardless of who you are, you can change things. If you wear the mask and keep your distance, your loved ones will be safe. If you avoid gatherings and use the COVID alert application, you will save lives. I know that the coming weeks will not be easy, but together we will get through this. Thank you.
Thank you, Prime Minister. We'll start on the phone with questions. One question, one follow-up. Operator.
Thank you. Merci. Première question, Raymond Fillon. À vous.
Thank you. Good morning, Prime Minister. I'd like to talk about healthcare funding. I know you will be discussing with the premiers on the 10th of December. No amount was announced in the economic update yesterday, so Does that mean that you'll arrive empty-handed at that meeting? On the contrary, Raymond, we talked about unprecedented investments that we've made in healthcare to help the provinces. We're talking about $1 billion directly to the provinces on top of the usual healthcare transfers, and more money for the stimulus package that will include monies for the return to school and for the most vulnerable people. So in total, healthcare investments represent an increase of almost 25% for this year's usual healthcare transfers. So we're going to continue to work with the provinces to get through this crisis, and I'm looking forward to that conversation next week on what we're going to do in the following years when we won't have this crisis to go through. But our priority right now remains to be there to help Canadians across the country with supports to the healthcare system now. Follow-up? Yes, but what the premiers are asking for, they're saying that it's not enough. They're asking for billions more in annual transfers. So where would this money come from, since it's not budgeted in yesterday's statement? Are you willing to go further into deficit, or would this money come from the future stimulus package, this $100 billion that Ms. Freeland announced yesterday? Answer: we are there we'll be there to talk to the premiers next week and the investments that we'll be able to make together in the years to come. But right now, you'll understand that our priority is to help Canadians get through this crisis. We are in an unprecedented moment. We've made one-time and responsible investments, and we will continue to look to what we can do now. Obviously, there will be conversations on what will happen after, and we will get into those conversations next week. Thank you.
Thank you. Merci. Next question, Bill Curry, The Globe and Mail. Line open.
Thanks, Prime Minister. Just to follow up on Raymond's questions there. This week's update says a $1 billion transfer to the provinces for long-term care will be contingent on the provinces providing detailed reporting on how the money is spent. Will you also be requiring detailed reporting on any new health transfers as you look ahead to the First Minister's meeting next week?
We're going to be talking about all that as we meet next week. But I think the important thing is to look at what we need to do right now. Right now, Canadians are suffering. Right now, in our long-term care system, right across the country, we've seen very, very real challenges. We saw them during the first wave. We stepped up as a federal government to support the provinces, get things back under control, but we continue to see too many deaths, too many vulnerable seniors in long-term care facilities right across the country. That's why we're moving forward with $1 billion more to help our seniors who are so vulnerable with extra supports for infection prevention and control. It's something that all experts are highlighting as one of those necessary things in long-term care facilities. It's certainly something that the Canadian Armed Forces and the Red Crosses have seen as a point of crisis. So we are there to help the provinces. We are there to continue to move forward on things that are going to help.
Follow-up, Bill?
Yeah, just to go back to the numbers, the update says the total federal transfers this year will be $99.7 billion, but then next year it's going to drop to $82.1 billion. So is that the plan, or are you going to put more money to the provinces through these negotiations and ultimately a bigger deficit than what you forecasted yesterday?
We're going to have conversations with the provinces about what their needs are right now through this pandemic, and we're all going to take a look at what the needs could be after this pandemic is through. But obviously, our priority, as we've said repeatedly to Canadians, is we're going to be there for you. The federal government has spent $8 out of every $10 invested in supporting Canadians through this COVID-19 crisis. That has had direct implications on healthcare and on the supports Canadians are getting. We're going to continue to be there for Canadians. I look forward to that conversation with the premiers to look at how we can ensure that we are supporting people right now and that our healthcare systems are sustainable into the future.
Thank you. Next question, operator.
Thank you. Merci. Prochaine question, Hélène Buzetti, Le Devoir. À vous.
Oui, bonjour.
Good morning, Mr. Trudeau. I'd like to come back to this $200 rather for children in the economic update. I'd like to know how parents with children under the age of 6 are more affected by parents who have children of, say, the age of 8, or others who might be earning minimum wage and simply don't have any children. So why privilege that group over others? Well, from the outset, with the Canada Child Benefit that we launched in 2016, we made a distinction between children under the age of 6 and those between the ages of 7 and 18, because we recognize that once a child is at school, there are lesser costs. There are fewer financial concerns for families, and they still need money, of course, and that's why we were very generous from the outset. But we recognize that in that particular situation, with the challenges of early childhood, that extra money directly in the pockets of these families is important. And therefore, we will be giving the middle-class families and those working hard to join it assistance up to a maximum of $1,200 per child for the next year in order to help with all of the expenses that they have for children under the age of 6. No, but the question, Mr. Trudeau, was how does that really answer? We have a tremendous deficit. You're being accused by opposition parties of burning through money, and when we see that there aren't many explanations for the rationality of this, why proceed in this way? Well, I think we spoke to Canadians across the country for whom the money that we sent to help families, workers, seniors, students throughout this pandemic, we talked to them about all of this to hear to what degree it made a difference. You know, people pay about 19% in interest rates on their credit cards. We didn't want people to use their credit cards and get even further into debt. So as the federal government, we chose to borrow money in order to give it to Canadians, because we are borrowing money at basically 0% interest these days. So obviously, it will take money to get through the pandemic, and the federal government has taken the decision to be there for families, to be there for small businesses, and to be there for those who have children. It's one of the reasons why Canada is getting through this pandemic in a better position than many others, because we understood that there were no choices to make between the health of people and financial health. In order to have both at the same time, we had to invest. I understand that the Conservative Party would not have done this. I understand that from the outset, the Conservative Party said, no, you should have helped businesses more and less families. But that's not our approach. Our approach, as I promised Canadians, is that we would have their backs, that we would be there to support them regardless of what happens, for as long as it's necessary for us to do so. So we recognize that families with young children have extra costs in these difficult times, and it's something that we've been doing from the outset.
Hello, Prime Minister. Mike Blanchfield, Canadian Press. I wanted to ask you about how you see the Health Canada approval process unfolding for the vaccines. Will Canada be able to accept advance shipments of vaccines prior to Health Canada approval so that they're here on soil and available for distribution? And if a Health Canada approval takes a bit longer than U.S. regulators because of your comments previously about wanting to get this right, should Canadians be prepared for the possibility they might not get a vaccine before they see Americans getting them? What do you say? What will you say to them then?
Our top responsibility is keeping Canadians safe. Now, in this COVID pandemic, keeping Canadians safe means getting a vaccine as quickly as possible. But it also means making sure that that vaccine is safe for Canadians. We will watch carefully what's going on around the world. Our Health Canada regulators are paying close attention at the same time as they are currently evaluating the 4 top vaccines that have come forward right now. We will ensure that all the steps are taken to make sure they're safe for Canadians, so that when we start rolling them out to Canadians, people can get that vaccine with confidence and know that we are getting through this pandemic together. But we know there are many different vaccine candidates out there. Some are going to be more effective than others. Some are going to arrive more quickly than others. And that's why back in the spring, we signed deals with, in the summer, we signed deals with 7 different vaccine companies because we didn't know which one would land first or which one would face extra bumps in the road or not. So we made sure that of all the possible vaccines, Canadians have access to the range of them and to, quite frankly, more doses potentially per capita than any other country in the world. Because every step of the way, we made a promise to Canadians that we'd get them through this, and that's exactly what we're doing.
Kevin Gallagher with CTV News. Prime Minister, we know that once vaccines start arriving in Canada, they will be prioritized for vulnerable seniors and healthcare workers. Where does that list go from there, and how much say will the provinces have in determining what the priority will be for, say, first responders, teachers, maybe politicians like yourself, sir? Where are you on that list? So give us an idea about that plan of prioritization and how much say the provinces will have in it.
Those are very much conversations that are ongoing right now. Obviously, as you pointed out, the priority is to get it out to the most vulnerable Canadians quickly. But we have a panel of top experts and scientists looking in directly to these challenging ethical and societal questions of who gets the vaccines access first. We talked about it with the provinces last week on our 22nd First Minister's call, and there was a lot of number of perspectives, but there seemed to be a consensus that we should all agree across the country on what that list looks like and make sure that it is applied fairly right across the country. There are more conversations to come, and we will keep Canadians informed as we determine what that right order of priority is. The other element of it is certain vaccines might be more effective with certain populations versus others, and that's why the experts are going to be so important in making determinations around what is the best path to move forward for our country. Okay. Nous avons mis en
We set up a group of experts and scientists, world-renowned, to examine this issue to see how to prioritize various populations in terms of access to the vaccine. I spoke about this with the premiers last week, and we agree that we will have to organize to be aligned in terms of the populations that will be the priority ones and the work that we will do across the country. I think Canadians expect that it will be fair, but at the same time, it's not politicians who are going to decide this. It will be based on the recommendations of experts and scientists, because we recognize that different vaccines can have different impacts on seniors or younger people or people from various communities. So we're going to optimize the impact of the vaccines is also a scientific concern.
CBC. Can I ask you a little bit about this this Johnson & Johnson vaccine that you're looking at, how that changes the equation, or does it change the equation in terms of when Canadians might see a vaccine? Can I ask you as well, I mean, specifically, what more information do you need before you can say, okay, here's when you're going to get a vaccine? And just to follow up on Kevin's, do you think that you're part of a priority group? Will you be one of the first people getting a vaccine when one is available?
The 4 vaccines that Health Canada is looking at right now, Johnson & Johnson, Pfizer, Moderna, and AstraZeneca, are all undergoing a process that Health Canada has accelerated, but is ensuring that we're not cutting any corners. As we approve vaccines, we will be able to roll them out to Canadians, and we're working to do that, like everyone is around the world, as quickly as possible while remaining safe. And I will highlight that there are right now no vaccines anywhere in the world approved for use by the general population. Everyone is working extremely hard. We're all sharing data. We're all making sure that we're trying to make the right decision as quickly as possible to both keep people safe and move through this as quickly as possible. We will continue to do that work and continue to work with each company on the particularities. But again, because we were so early in signing deals with so many different vaccine producers, we actually have a very good position for receiving vaccines and being able to distribute them to Canadians. But those conversations are obviously ongoing, and ultimately getting to the starting line is something we're all focused on. But we're also need to be focused on getting to that finish line and getting the majority of Canadians vaccinated. And that's where having potentially more doses per capita for Canadians than anyone else is going to be very helpful to us. In regards to where politicians are on that list, again, I'm going to trust experts to make the right determination of what the priority populations are.
Bonjour, Monsieur Trudeau. Laurence.
Good morning, Monsieur Trudeau. This morning, you said in an interview that you were concerned about having new recurring expenses in terms of healthcare. Does that mean that the recurring transfers to the provinces, I'm not talking about the one-time investments, but does that mean that those regular transfers will not increase? Well, we'll have these discussions with the provinces next week. As I said several times, and as you said, the one-time investments are being made, will be there to help the provinces and territories and our seniors and all groups to help us all get through this pandemic. The federal government will continue to be there to do everything necessary to help Canadians to get through this. Once we are on the other side of it, we will obviously continue to make investments in the healthcare system and look to the future, and we'll have those conversations with the provinces next week. I'm looking forward to those conversations on the future of our healthcare system. I will listen to the provinces, but as I said, we weren't going to announce in this economic statement investments that will be recurrent long-term ones when our emphasis and our priority is on the current situation.
I think one of the things we all know is that we need to do everything we can to support people right now through this pandemic. And that's where the federal government has stepped up to support the provinces with billions, $25 billion in safe restart agreements, in back-to-school agreements, in supports for vulnerable workers. We have continued to be there directly to support the provinces, including increasing healthcare transfers significantly this year, while at the same time we've been there directly for Canadians, for families, for young people, for seniors, for workers who've been laid off, for small businesses, for industries. We are going to be there and continue to be there for Canadians. That's our focus right now. Obviously, as we get through this pandemic, we do need to reflect on the future of our healthcare system, and that's why I'm looking forward to having those conversations with the premiers. But we weren't going to build in recurrent long-term funding in our economic update when those conversations haven't happened yet with the premiers, and where our focus, quite rightly, needs to be on the contextual and punctual spending we are doing responsibly to move forward through this pandemic.
Hi, Prime Minister. Mercedes Stephenson, Global News. You're introducing historic spending in the fiscal update that you presented yesterday, and your Finance Minister and Deputy Prime Minister Chrystia Freeland talked about there being guardrails. But there's not a lot of details about what the triggers in those guardrails are. Will you be disclosing to Canadians what the amounts of things like total hours worked or the employment rate are that will guide your stimulus spending, and will you be putting the spending to a confidence vote?
As we've seen in recommendations from the International Monetary Fund, from the World Bank, from global financial institutions who've said, do not make the same mistakes that were made by many countries, including by this country under the previous government, of turning off the taps too quickly after a recession. In the 2008-2009 recession, spending was scaled back too quickly, and that austerity hurt Canadians. What we are going to be doing is continuing to be there as long as it takes for Canadians to get through this pandemic and kickstart the economy once again so it can come properly roaring back. That's why we've set aside 3 to 4% of GDP as that fiscal stimulus once we are through this pandemic. We know that that's how you ensure the long-term health of our economy, the long-term sustainability of our finances, is by making sure that the destruction wreaked on our economy by this pandemic is minimized. That's why the federal government has stepped up with 8 out of every $10 spent on supporting Canadians through this directly from the federal government. So we're going to do this responsibly. We're going to keep in mind that we came into this pandemic with the best fiscal position of any country in the G7, and we still have that best comparative fiscal position, and we're going to continue to maintain that and look to get back to a path that is long-term sustainable. But right now, while this pandemic is going on, we know the best thing to do for people's health, but also the best thing to do for the economy, is to be there to support small businesses every step of the way, to be there to support workers every step of the way, and to prevent Canadians from having to go into credit card debt at $19% interest rates when we can borrow at near 0% interest rates. That's why we've stepped up as a federal government, and that's why it is sustainable for the longer term.
With all due respect, Prime Minister, that doesn't answer the question of what the fiscal guardrails look like or whether you'll put it to a confidence vote. But we have one last question. So I'd like to ask you about a statement the lobbying commissioner made at committee last week, saying that 3 cases she was looking into have been referred to the RCMP for criminal investigation. Are you aware of whether any of those cases involve the We Charity or the husband of your chief of staff, Rob Silver?
First of all, on the question of the confidence vote, this is a fall economic statement. This is an economic measures that, of course, will be a matter of confidence. But I am reasonably confident that none of the opposition parties wants an election right now. We certainly don't want one. We want to get these supports out to Canadians, and there are certainly things in this fall economic statement that every party should be able to support in terms of helping Canadians. In regards to the investigations, I have no information on that. Merci tout le monde.
Thank you, everyone.
All right, that is the Prime Minister of Canada on this Tuesday, just a day after his government released their fall economic update, what many people thought was more of a mini budget. Lots of questions there, again, about vaccines. As Catherine pointed out, I think he's going to get those questions until we're all vaccinated, potentially. And again, lots of questions about healthcare transfers to provinces. And that's because last night, the Intergovernmental Affairs Minister Dominic LeBlanc did announce that there will be a First Minister's meeting, a virtual one, on December 10th to talk about that and some other issues. Let me bring back David and Catherine. David, what stood out there for you?
I think we're seeing some interesting rhetoric come from the Prime Minister now in really kind of pushing back against some of the criticism they've been receiving from what I would call grumpy premiers and also the federal Conservatives. If you look at the line, the 8 of every $10 that has been spent on pandemic response has been spent by the federal government. That is sort of a way to inoculate the government, if you will, from the criticism from the premiers that they've dragged their feet and maybe not done as much as they could when they've in fact done the heavy lifting on direct supports to businesses and to Canadians. And then the line that goes back to the last giant fiscal crisis of a decade ago, the criticism aimed at the former Harper government for pulling back some of the stimulus spending in the eyes of some people, not the Conservatives, of course, as too early in the process, and that stalled the recovery coming out of the global financial crisis. You had a period of time after that crash where the fiscal policy of the government was out of sync with the monetary policy of the Bank of Canada, which was cutting interest rates to try to encourage spending, while the government was sort of trying to get back to a balanced budget because that was a core part of their political message. The contrast I think the Prime Minister is trying to draw there is that we will be there for you in the aftermath of this crisis in a way the Conservatives, our main rival for government, were not there for you a decade ago. So it's a political point that he is making, but on the 8 and 10 spending thing, especially with the First Minister's meeting coming up next week, where their demand is for $28 billion in permanent annual spending for health care, taking the opportunity to remind Canadians just how much the federal government has been spending.
I'm glad you brought up the 2008 recession point, because I jotted that down as well, because obviously that's a clear political line to the Conservatives. It's also a little bit disingenuous, I will say, of the Prime Minister. It was not a comparable recession. And in fact, the Conservatives in 2008 did promise to try and cut off spending and bring the country back into balance. After they were threatened with their government toppling and a coalition taking over government, they then decided to prolong spending for 2 more years. So yes, there was a period of time where they were going to do that, but to save their own political butts, they turned around and went in a different direction. So, I mean, he gives you the beginning of the story. He doesn't give you the end of the story, I guess is my problem with that analogy. But we see the politics behind it for sure. Catherine, maybe I'll get you to weigh in on that or the vaccines, because obviously there was lots of questioning there.
Yeah, a lot of interesting things that came out of that. We were talking about politicizing things. Let's talk about the Prime Minister's efforts to, I think, in some respects, he made an effort to depoliticize some of the conversation around the vaccine process, right? Particularly those questions about who is going to get it in what order. This is one of the many reasons that you saw that the government has set up these various task forces that it can consult, particularly a vaccine task force, so that when you start getting into tricky questions, and of course, another important reason is just having the best medical expertise available to you. Sure. But also, when you get into tricky questions like you, sir, Prime Minister of the country, where do you belong in the order of who is most essential to get this vaccine? He is able to say those decisions are not going to be made by me. They are not going to be made by politicians. They are going to be made by people with expertise in this matter. It also, when it comes to that priority list, and I think generally people can appreciate the kinds of priorities that we are talking about. We know that the vast majority of deaths have come from long-term care facilities. And so it seems like common sense, I think, for those of us who don't have expertise, that of course you would try to start in long-term care facilities, both the workers there and the people who live there, because we know that they are so vulnerable. We can understand just generally the importance of frontline workers, but perhaps some of these conversations get a bit more complex when we start talking about, yes, politicians. What about prisoners, right? People who are living in shared living facilities, the homeless, who may be vulnerable simply because of the kinds of conditions they live in, and how does the general population react to that? Referring to these experts does allow him to, I think, in some ways depoliticize those decisions. I thought it was very interesting to hear him say that there's consensus among the premiers that this decision should be made on a countrywide basis, because it did seem that once again we would be in a situation where things might vary from province to province. Now, while I talk about depoliticizing, though, I do think it's important to say this whole question around vaccines, ultimately it is an incredibly political one. I mean, many observers have said a lot of Canadians are waiting to see how this goes. We are wondering to what extent Canadians themselves will be comparing themselves to the rest of the world and the order in which all of this rolls out. I think the more candidates that submit their vaccine data for approval, the more the federal government can say, hey, look at our portfolio, we've done the work. But the question still remains to be seen, and the point has been made time and time again. Vaccines don't save people, vaccinations save people, right? The shots actually have to get into the arms, and thus the questions will continue about the logistics of how that's going to happen and when.
Yeah, go ahead, David, sorry. Yeah.
No, I think it's an interesting question about some of the vaccine priorities, right? Because there are some things you wouldn't think about as sort of essential, like meat packing plants and food production, like to secure the food supply. You want to have that near the top of the list. But also, the question about politicians. No politician wants to be seen as jumping the queue and prioritizing themselves. But when one of the issues that people are concerned about with getting uptake on the vaccination programs is confidence in the safety of these things, the images of Prime Minister Justin Trudeau, Premier Jason Kenney, Premier Doug Ford getting the vaccines to reassure some skeptical people in the public that this is safe, I'm doing it too. There's value in that, right? But at the same time, the risk of being seen to prioritize your interests over other people. It's an interesting one to see how they manage from a communications perspective, because we did see the Prime Minister tweeting out a picture of him getting his flu shot earlier this year to encourage, the people get their influenza vaccine. Something like that seems like it would inevitably need to be part of the communications plan around trying to get uptake on a vaccination program, because there are percentages of the population that are skeptical of vaccines writ large, but also skeptical of these because of the speed at which we've gotten to this point.
Or even, I was just looking at the screen, Dominic LeBlanc, the Intergovernmental Affairs Minister, who's immunocompromised after a long battle with cancer. So you can kind of see he would probably fall into one of the priorities, but there's political risk there. Just one last thought from both of you on the healthcare transfers. A reminder that the provinces are looking for an increase of 13%, which equals something like $28 billion in healthcare transfers. I know they're going to have this call. It didn't sound to me like an encouraging message from the Prime Minister that this was going to happen. But give me your take, Catherine and David. Catherine.
I'll just say, I mean, again, setting expectations. You saw the Prime Minister really making an effort there to say, yes, we're going to have those discussions about healthcare transfers, but let me emphasize again how important that money is for long-term care. I mean, in some ways, he is, to use a word David used earlier, amplifying, part of his thesis from this fall economic update, which is we need to deal with now. Now we are starting to make plans for what is on the horizon. Will that satisfy the premiers remains to be seen. And important to note as well, that $1 billion for long-term care, it's not like that's not politically contentious as well. Rosemary, there are a lot of, as you know very well, sort of checks built into that information that the provinces have to provide. They are not likely to necessarily be thrilled about that.
David, your thoughts on whether provinces would listen to the Prime Minister there and feel encouraged about the direction of this meeting next week? And I mean, it's only the beginning of the conversation, to be fair.
Yeah, and I think there's almost two conversations that are happening that need to come together. There's the conversation about permanent increases to long-term healthcare transfers. There's also Pharmacare, and what does that look like? Because they intertwine. You know, if the federal government takes over an extraordinary share of drug coverage and drug costs and puts that on the federal books, then the need for, say, $28 billion to the provinces can decrease substantially, because rising drug costs is one of the big drivers, especially on rare diseases and catastrophic drug coverages, are one of the big drivers of annual health increases in addition to salaries. On the point of the long-term care money and the need for conditions, that's very similar to what we saw with the school program, the $2 billion that Trudeau announced in August, I think, for a safe school restart. That also had conditions on it. I get the sense from talking to some federal officials that they kind of don't want to see them come up with a couple of $1 billion to deal with an immediate crisis, send that to provinces, and then have that displace federal spending, right? So this is one of the conversations that's happening as well. But you can't really settle on the healthcare thing until they figure out what Pharmacare looks like. And we were expecting something on that yesterday, and all we really got was a promise to work on it and come up with some proposals.
Okay, David Cochrane, Catherine Cullen, thank you for your help with our coverage. I guess I'll see you probably Friday. Back in the same place. Thank you. Let us take you now to the public health briefing with public health officials and the gentleman I mentioned earlier, Dominic LeBlanc, Intergovernmental Affairs Minister. We will take this briefing live. Natasha Fattah will pick up our coverage for here. I'm Rosemary Barton. Thank you for watching.
To work together to ensure the health and safety of Canadians, but also to ensure the strength of our economy. To date, we have made available in direct supports to provinces and territories amounts of money totaling over $24 billion. Et la réunion du Premier Ministre.
And the meeting of the Prime Minister with the premiers of the provinces and territories last week marked the 22nd time that we have held a premiers meeting since the month of March. We are committed to collaborating with the provinces with a view to setting up a vaccine, and our frequent conversations with the provinces and territories will not stop there. Last night, we announced that on the 10th of December, next Thursday, we will once again meet with the premiers to discuss the pursuit of our combined work against COVID-19, the work on healthcare, and the preparation of the distribution and logistics for the vaccines.
Will be a national endeavor, and as such, Canada is collaborating with provinces and territories, Indigenous partners, and private sector partners as well to ensure the appropriate planning and infrastructure is in place to receive and distribute the vaccines. These discussions are not new. Discussions with provinces and territories have been ongoing for many months, in fact, since May, on details of a potential vaccine rollout. Members of the Canadian Forces, as the Prime Minister announced last week, have begun discussions with provinces and territories to ensure a coordinated effort for the delivery of the vaccine. Our Team Canada approach will ensure that when a vaccine is ready and approved as safe and effective, everyone can access a COVID-19 vaccine as seamlessly and as effectively as possible. Our support for Canadians has not once wavered, nor will it, as we head into the critical coming winter months. So with that, I thank you very much. And now I'll turn to my colleague, the Minister of Health, Patty Hajdu.
Thank you very much, Minister LeBlanc. And first of all, let me just start by saying today is World AIDS Day, and it's the beginning of Aboriginal AIDS Awareness Week. And it is a good time for all Canadians to learn more about HIV, to protect themselves and their communities from the infection of HIV, and to reduce HIV-related stigma. And Health Canada actually recently just approved the first HIV self-test kit in Canada. This 1-minute self-test allows people to see if they have an HIV infection through a single drop of blood in the privacy of their own home, with advice on the packaging for what to do next if they test positive. And this was actually created through an investment in research in HIV testing technologies here in Canada. Now, as Minister LeBlanc said, we continue to prepare for Canada's immunization campaign for COVID-19. And so far, $285 million has been allocated to distribute COVID-19 vaccines to Canadians. Yesterday, we received an application from Johnson & Johnson, which is our 4th application, one of the first, if not the first country in the world to receive that application. In fact, Canada's regulators are highly regarded around the world. We're considered gold standard regulators. That means that we are watched closely by other countries that don't have as robust of a regulatory system for indications of safety. And companies themselves know that we have an attractive and trusted regulatory pathway, so this speaks highly to Canada's regulatory system. We're also working with other countries' regulators to make sure that we can share data and analysis. Obviously, the world is seized with trying to analyze the data coming out of manufacturers as quickly as possible. This really ensures that we have a coordinated response with other countries as well. Canadians can be sure that whatever Health Canada approves in terms of vaccines will only be done when it's entirely safe to do so. And our work with provinces and territories on the distribution side is ongoing. And the plan is shaping up very well. So I say to Canadians, hang on. We can get through this winter together, and relief is on the way.
Patty, thank you very much. And now we'll turn to our colleague, Minister Anita Anand. Anita?
Merci beaucoup.
Thank you very much, Dominic. It's a pleasure to be here with you all.
About PPE, tests, and vaccine rollout. As we heard from yesterday's fall economic statement, our government has taken unprecedented steps to keep Canadians safe. Our plan is, and always has been, to protect the health of Canadians, jobs, and the economy. We are accomplishing this through aggressively pursuing contracts with a variety of suppliers to meet and indeed exceed current needs and to prepare for the future.
First of all, personal protective equipment. I am pleased that we have obtained more than 2 billion pieces of personal protective equipment, and more than half of those have already been shipped.
Over 40.5 million rapid tests, 3 times the total number of tests performed in Canada since the pandemic began. And our government continues to gain access to the most effective treatments for COVID-19, such as Eli Lilly's and Abcelera's antibody treatment. In short, we have conquered the PPE procurement challenges and the rapid test procurement challenges, and vaccines will be no different. Turning now to vaccines. We all long for a return to normal. And the only way out of this pandemic is through following health and safety measures and continuing to pursue a vaccine. À cette fin,
to this end, we have acquired the most diversified portfolio of candidate vaccines in the world. We have agreements in place to obtain up to 414 million doses of the 7 most promising candidates and up to 15 supplementary doses thanks to the international COVAX initiative.
Canada is very well positioned in terms of its vaccine procurement. In particular, I wish to address some misinformation. Despite misinformation to the contrary, Moderna has publicly confirmed that Canada was one of the first countries in the world that it signed an agreement with for its vaccine candidate, and indeed has stated publicly that Canada is at the head of the line for its vaccine doses. Second, Pfizer has publicly confirmed that Canada was the 4th country in the world with which it signed an agreement. Third, Canada was the first country without large-scale domestic capacity to secure a bilateral deal with AstraZeneca. Pending regulatory approval, vaccine doses will begin arriving in the new year. And I wish to say that I am personally engaged with a variety of suppliers to ensure that deliveries take place as soon as possible. Moving now to vaccine rollout. From a procurement perspective, Canada's rollout plan has 3 key components: regulatory approval, distribution, and administration. On regulatory approval, Minister Hajdu has stated that Health Canada has now received applications for approval from 4 of the leading vaccine candidates: AstraZeneca, Moderna, and Pfizer, and Johnson & Johnson having applied yesterday. This process is proceeding well, and we should remember that Health Canada, as a regulator, is the gold standard of regulators among the world and will ensure that a vaccine is safe and effective before we roll it out to Canadians. The integrity of the regulatory process is fundamental to the healthy and safety existence of Canadians. Moving now to distribution, the second part of our rollout plan. De plus.
Moreover, we have bought freezers with the capacity to store the most promising vaccine candidates, particularly from Pfizer and Moderna. We have now received 38 of these freezers and recently ordered 92 more for a total of 126.
I'd like to repeat that as despite my public comments about this procurement, this is another area where there has been significant misinformation. I will therefore reiterate in English that we have purchased 126 cold and ultra-cold storage freezers with the capability to store the most promising vaccine candidates, namely Pfizer and Moderna. We have received 34 of these freezers, and we have 92 more on the way. Together with existing federal capacity, we can store 33.5 million frozen and ultra-frozen doses of vaccines. In addition, a request for proposal issued by my department to 4 pre-qualified bidders that could help with end-to-end logistics for vaccine delivery across this country closed this past weekend. We anticipate having contracts in place in the coming days. I will return to publicly announce those contracts. Finally, the third phase, administration. We have known all along that this vaccine rollout would be crucial and complex, not to mention a massive undertaking, which is why we did not wait to act. Because of our early action, right now, we have a sufficient supply of syringes, needles, gauze, swabs to accommodate 25 million doses of an administered vaccine, with many more supplies en route. We also have contracts in place for additional supplies to administer additional doses should the needs arise. To conclude, I would like to reiterate that I and we as a government will not cease in our efforts to ensure that when a vaccine is ready, le Canada sera prêt aussi.
Canada will be ready as well.
Merci beaucoup.
Anita, thank you very much. We're now going to turn to Dr. Tam and Dr. New. Dr. Tam.
Good day, good afternoon. Bonjour à toutes et à tous.
Good afternoon to all.
378,139 cases of COVID-19 in Canada, including 12,130 deaths. Nationally, there are over 66,000 active cases across the country. And over the past week, laboratories across Canada have tested an average of over 74,500 people daily, with a 7.4% testing positive. Yesterday, just over 6,100 cases were reported nationally. In addition, there were over 1,750 new cases reported for Saturday and Sunday. This brings the average daily case count to close to 5,800 cases for the past week. The number of people experiencing severe illness continues to increase. Over the past 7 days, there were, on average, over 2,250 individuals with COVID-19 being treated in Canadian hospitals, including over 450 in critical care, and an average of 87 deaths were reported each day. Today marks World AIDS Day, a day where global community comes together to remember those we have lost, to honor what has been achieved, and to recommit ourselves to the work that remains to be done. This year, I am reminded that, like COVID-19, the health, social, and economic impacts of HIV have been felt to a greater extent by some. We know that COVID-19 and the public health measures implemented to slow the spread have had an impact on the availability of sexually transmitted and bloodborne infection prevention, testing, and treatment services, including harm reduction services. Despite these many challenges, there are still places we can turn to for hope. While there is no vaccine against HIV, there are highly effective treatments. Individuals living with HIV who are on treatment and maintain a suppressed viral load cannot transmit the virus to their sexual partners, which is otherwise known as undetectable equals untransmittable. U equals U. I am also encouraged by innovations, such as the recently authorized HIV self-test, that is an important additional tool for improving access to testing in a safe and confidential manner. None of this would be possible were it not for the efforts of community leaders, researchers, health providers, and peers who see to it that those most in need are not left behind during these challenging times. At this time, let us take inspiration from them and do our utmost to protect our families, friends, and communities by doing our best to maintain individual protective practices while supporting others who may be struggling. It is safest for all of us to limit errands and outings to just the essentials, limit in-person activities to just our existing household members, and keep up with key prevention practices. Stay home if you have symptoms, practice physical distancing and frequent hand washing, wear face masks in indoor public spaces, and avoid the 3 C's: crowded places, closed spaces, and close contact situations whenever you can. Thank you. Merci.
Bonjour à toutes et à tous.
Good afternoon, all. There have been 378,139 cases of COVID-19 in Canada, including 12,130 deaths. Nationally, there are over 66,000 active cases across the country. Over the past week, labs across Canada have tested an average of over 74,500 people daily, with a 7.4% testing positive. Yesterday, just over 6,100 cases were reported nationally. In addition, there were over 1,750 new cases reported for Saturday and Sunday. This brings the average daily case count close to 5,800 cases for the past week. The number of people experiencing severe illness continues to increase. Over the past 7 days, there were on average over 2,250 individuals with COVID-19 being treated in Canadian hospitals, including over 450 in critical care, and an average of 87 deaths were reported each day. Today marks World AIDS Day, where the global community comes together to remember those we have lost, to honor what has been achieved, and to recommit ourselves to the work that remains to be done. This year, I am reminded that, like COVID-19, the health and social economic impacts of HIV have been felt to a greater extent by some. We know that COVID-19 and the public health measures implemented to slow the spread have had an impact on the availability of sexually transmitted and blood-borne infection, prevention, testing and treatment services, including harm reduction services. Despite these many challenges, there are still places we can turn to for hope. While there is no vaccine against HIV, there are highly effective treatments. Individuals living with HIV who are on treatment and maintain a suppressed viral load cannot transmit the virus to their sexual partners, which is otherwise known as undetectable equals untransmittable. I am also encouraged by innovations such as the recently authorized HIV self-test. That is an important additional tool for improving access to testing in a safe and confidential manner. None of this would be possible were it not for the efforts of community leaders, researchers, health providers, and peers to see to it that those most in need are not left behind during these challenging times. At this time, let us take inspiration from them and do our utmost to protect our families, friends, and communities by doing our best to maintain individual protective practices while supporting others who may be struggling. It is safest for all of us to limit errands and outings to just the essentials, limit in-person activities to just our existing household members, and keep up with key prevention practices. Stay home if you have symptoms, practice physical distancing and frequent hand washing, wear a face mask in indoor public places, and avoid the 3 C's, crowded places, closed spaces, and close contact situations whenever you can. Thank you.
Dr. News. Thank you, Dr. News. We're obviously now ready to take questions.
We'll begin with the telephone questions. You'll have one question and one follow-up.
First 2 questions. As a reminder, 1 question, 1 follow-up. Operator, off to you.
Thank you. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. Our first question is from Christy Kirkup from Globe and Mail. Please go ahead.
Hello, good morning. Can you hear me okay?
Yes, please go ahead.
Okay, great. Thank you very much. I'm wondering if we can please look at the federal health transfers. Specifically, is your government willing to commit to increasing the federal health transfers as demanded by the premiers ahead of the First Minister's meeting?
Minister LeBlanc?
Sure. So thank you for the question. As you know, our government has committed many months ago at the request of the premiers to have a discussion on healthcare, on the healthcare elements of supporting Canadians, obviously in the context of the pandemic, but looking at a way to have a sustainable long-term basis for healthcare. So we announced yesterday, I announced yesterday, I think the Prime Minister did as well, that meeting will take place next Thursday on the 10th of December. So we're looking forward to that conversation with Canada's First Ministers Obviously, we're going to take stock of the public health emergency facing the country now, the supports necessary that have been put in place collaboratively with provinces and territories to support healthcare and public health measures, not to mention the economic measures necessary to support Canadians and Canadian businesses. But that conversation will be happening next Thursday on December 10th. And we approach that with a lot of good faith and the spirit of collaboration, which has defined all of the conversations we've had with provinces and territories since the beginning of the pandemic last March.
And just as a follow-up, Minister, the economic update says that all federal transfers combined jumped from $72 billion last year to $99.7 billion this year, but it's projected to drop to $82 billion in 2021-2022. Is that the plan, or is Ottawa going to be boosting the transfers and then ultimately posting a higher than forecasted deficit?
So you're correct. The budgeted transfers include, as I mentioned in my opening comments, $24 billion that we've transferred so far to provinces and territories directly related to measures required in the context of COVID and the public health emergency, things like contact tracing, testing, and other measures, long-term care measures, other measures necessary to support healthcare systems across the country. We've also said to First Ministers that and I think we're seeing across the country, the depth of the second wave, the challenge facing the country in terms of the second wave and the difficulties in every part of the country that governments and health authorities are having in terms of meeting the needs of supporting their populations in the second wave. So we are always available and always willing to talk to provinces and territories about their needs next year in terms of measures to support Canadians during COVID-19. But the discussion of how to support a long-term sustainable public health system, which is a priority that we share with all governments across the country, will be very much the subject of the discussion we're looking forward to having with premiers next Thursday.
Merci. Prochaine question. Next question.
Merci. La prochaine question est de Émilie Bergeron de l'agence QMI. À vous la parole.
Oui, bonjour.
Good afternoon. My question is also for Mr. Leblanc. Yesterday, when you announced that the meeting would take place on the 10th of December, you didn't directly mention the transfers in French. You were talking about a range of subjects. And for the premiers, is this uniquely a meeting concerning healthcare transfers? Or do they have the impression that you're trying to drown this in amongst a bunch of other subjects? Well, no, we're not trying to drown out the conversation on needs in the healthcare system. We are looking at the state of the healthcare system in Canada in the context of the worst pandemic that's taken place in 100 years. So to have a clear conversation with the provinces and territories on the future of funding for the healthcare system in Canada, I think we also have to start the conversation with a discussion on the current state of the fight against COVID-19. What can we continue doing together with the provinces and territories? The importance, for example, of having a logistical strategy for the vaccine, which it seems will be coming in the next few weeks. So all of this necessarily is part of the findings that we have on the healthcare system across the country. But we've never hidden the fact that we will also be prepared to discuss with the premiers the future of transfers and the financial situation of the provinces and of the federal government in terms of the support for healthcare in this country. So all of this will be part of discussions. I can't imagine that it will be anything but friendly and collaborative as it was before the beginning of the pandemic. The follow-up? And the request for an increase in healthcare transfers, that existed before the pandemic. And it was exacerbated and with the pandemic, of course. They are looking for more money, so I don't understand your logic saying that we have to start the conversation talking about the current fight against the pandemic. Well, once again, the situation of the pandemic has necessitated extraordinary investments on the part of the federal government. And we will be supporting health care measures. We never talked about the cost, for example, of obtaining all of the vaccines that my colleague Anita Anand referred to earlier. It's the federal government that will ensure that these vaccines are free to Canadians. And since the outset of the pandemic, my colleague at the department, the Minister of Finance, set out yesterday hundreds, literally, of billions of dollars in support that we have put at the disposal of Canadians, of small businesses, in order to protect them in the context of the pandemic. And also, almost $25 billion being directly transferred to the provinces for the necessary expenditures related to COVID-19, including in their healthcare system. So one doesn't take away from the other. If we could have discussions with the provinces on the future of public health care, we are going to begin with the findings of the hundreds of billions of dollars that the federal government has already spent in terms of available supports to Canadians and for the healthcare system. But we're completely open to discussing with the premiers, as we have said from the beginning. If we have had 22 meetings to date with the premiers of the provinces and the territories, and during many of these meetings I was present, we also discussed the importance of the healthcare transfers, and that's why the Prime Minister accepted that we would have this meeting next Thursday. Thank you. We'll move to the room.
2 questions, and we'll head back to the phones afterwards, time permitting.
Hi, Mackenzie Gray with CTV News. This is either for Minister Anand or Minister Hajdu. In the U.S., the Secretary of Health, Alex Azar, said, and this is a quote, "Within days of FDA approval, we'll start seeing vaccines in people's arms." So in a bid to avoid misinformation, which Minister Anand, you pointed out, seems to be an issue that your government has with what we've reported, can you give us a clear timeline on after the vaccine is approved in Canada, how long it will take for shots to be going into people's arms?
Well, thank you very much, Mackenzie, for the question, and I'll just say this to Canadians. We will begin immunization when it's safe to do so, and we are working actually hand in glove with Procurement Canada and with the manufacturers, by the way, around the world who are also eager to get doses out to Canadians and into the arms of Canadians and, in fact, world citizens. But this is a very delicate dance. We need to make sure, first of all, that the vaccines pass regulatory approval. And as I said in my remarks, Canada is a gold standard regulator. We're respected around the world for our regulatory process. First of all, because it's smooth and it's fair, but it's also a standard of safety, which in fact many countries look to when they're doing their own approvals. Secondly, we're working with regulators from other countries, including the FDA, the EU, the UK, to make sure that we can share data and share our findings of that data as quickly as possible, because of course that helps accelerate approvals for all of us. And thirdly, we're working with the provinces and territories to be able to receive shipments of doses as soon as they become available from the manufacturers, and the manufacturers, of course, have timelines for deliveries as well. So we're in a good shape. I will say this, Canadians are in good shape to receive early doses, and more importantly, I think safe doses of vaccines when they're available.
And Minister Anand, do you have anything to add on that?
Sure. The crucial point for delivery dates is the date of approval given by Health Canada. Then our delivery processes kick in. And you will recall that I have said this repeatedly, as has my department when asked. We knew when we put these contracts into place back in August that there was going to be a question relating to when Health Canada approval would be forthcoming. And that's why our delivery schedules are based on delivery windows or time frames as opposed to one specific date. That's the prudent way to contract. You understand that there is uncertainty in the future. You put the contract in place and you continue to negotiate in terms of when deliveries can precisely occur within a given time frame based on Health Canada approval. And that's exactly what we're doing. And the reason why we've been able to secure the most diverse portfolio of any country in the world and the most number of doses per capita of any country in the world is because we were aggressive in our contracting with Moderna, with Pfizer, with AstraZeneca, so that we could put Canadians in the best place possible for vaccine distribution once Health Canada approval is forthcoming. That should not be forgotten. Our priority is to get vaccines out to Canada, but we will only do so once we are told by the regulator that these vaccines are safe and effective. And I believe that is exactly what Canadians expect of their government. And that's exactly what we will deliver on. Thank you.
In terms of who gets the vaccine, I think there's broad-based agreement that elderly Canadians and frontline workers should be at the front of the line to receive it. But for Minister Hajdu, once we get past that point, do you envision it being the federal government who decides who gets the second or third or fourth decision on who receives it, or will it be the provinces? And for Dr. Tam and Dr. New, what populations after elderly and frontline workers do you think should receive a vaccine in the early stages of distribution to ensure the best COVID outcomes?
Well, thank you very much, Mackenzie. I'll start, and I will turn to the doctors because they've worked extensively with the National Advisory Committee on Immunization, who has actually given us a broad buckets of priority populations, who should receive it first, all with the goal of saving lives and stopping the spread. That is the entire goal of the prioritization process. And so I'll just say this, at the national level, these are recommendations, and then they are further shared with provinces and territories, who will then have to refine those prioritizations based on their own processes. That's the work that Dr. Tam is doing with the Special Advisory Committee, and so I'll turn to her to speak to those negotiations.
It's the provinces who will make the decision, correct?
At the end of the day, it is the provinces who deliver health care, and it is the provinces who will decide on the priority populations. And of course, we're working closely to make sure that we have coordination across the country and that we agree on the principles, which in fact we have. We have a shared set of principles now as a country across provinces and territories with the federal government. And finally, I'll just say there are also some federal populations that we will obviously have to take care of ourselves as the federal government.
Yes, so we have, and I think the chair of the National Advisory Committee on Immunization has done some communications already. What that committee would do is once the data is being made available, for example, to the regulator, we will be getting hold of that information, because what you need to do is to see the exact data in terms of the age groups, the safety, and the efficacy information. And so each of the vaccines may have similar but slightly different groups of people that they've got the data on. So that's really important as the first step. So then the prioritization will take into account the epidemiology of who's at higher risk and who may be at increased risk of transmitting to those higher risk, which is the sort of preliminary set of priority groups that the NACI has essentially already published. What we're going to be doing right now is getting more granular with the planning for the delivery to those specific groups. After that, I think what one might envisage is that the age groups, for instance, that's the easiest way to think about how to prioritize the population outside of high risk and those who can spread to those at high risk. And also, we're also obviously prioritizing those in higher risk settings and remote and isolated areas, and discussing with First Nations, Inuit and Métis leadership on their priorities. But then the age group is, based on all analysis, is actually the easiest and the most scientifically sound way, I think, of increasing the population coverage post that time. We know that underlying medical conditions puts people at high risk, but when we actually analyze all the different underlying medical conditions and the age, it still comes out that the age is, in fact, the most important when you look at severe illness and mortality. So some of those will be, sort of discussed. Kids haven't really been engaged in a lot of the clinical trials. So that'll be another age group for which data is needed. And we will be looking towards more data on pregnant women as well.
Hi everyone. David Thurton, CBC News. Thank you so much for joining us in person and virtually. Really appreciate that. Minister Anand, I just wanted to follow up on my colleague from CTV's question. You were talking about windows for delivery. Maybe I missed it, but can you specify what the timeline for delivery, what that window looks like? Is it a week? Is it 2 weeks? I know you can't give us a date, but can you be more precise about what that window looks like after we see a safe vaccine approved?
Most definitely, and thank you so much for the question. I want to begin by reiterating that at the current time, the delivery window is within the first quarter of 2021, and that is based on Health Canada approval that we hope is forthcoming. But of course, we as politicians do not have input, nor should we, into the regulatory process. So at the current time, we are looking at the first quarter of 2021. That's the delivery window. But as I said, I am negotiating with our vaccine suppliers every day for earlier delivery dates. And so when that Health Canada approval is forthcoming, we will kick into the delivery process ASAP. That's why we have the refrigerators procured. That's why we have the syringes and the needles and the gauze procured. And that's why the conversations are occurring with the provinces as we speak, so that as soon as Health Canada has provided its approval, we are well placed to begin deliveries to Canadians as soon as possible.
So just a follow-up and then another question. Are we to assume that the delivery window is 3 months after a vaccine is approved? Because is that the window we're looking at? And then I have to ask a question about prioritizing who gets this vaccine. I know you just said that it's the provinces that will ultimately decide, and you have shared principles, and those shared principles seem to be based on age. But I'm also wondering what your shared principles say about people who are working in grocery stores, who are cab drivers, who are bus drivers, who tend to be low-income, racialized, quite vulnerable and quite hard hit from COVID. So, Minister Anand, if you could just clarify the window, is that a 3-month window? And then if you could answer my second question, Dr. Tam, that'd be great.
Sure. I understand the desire for the greatest possible specificity around the delivery dates, because we all want to see an end to this pandemic, and we believe that the vaccine is perhaps one of the ways that we will emerge from this pandemic on the other side. I feel that, you feel that, we all feel that. So I want to add, though, that while there's pressure to move at the speed of politics, we will not rush the science, because our top priority is the health and safety of Canadians. It is not possible to circle a single date on the calendar, but I can assure you that as soon as Health Canada approval occurs, our delivery process will kick in, and we will make sure that vaccines are coming early in the new year. This is built into our agreements, and I am personally and actively engaged with a number of our suppliers to ensure that this happens as quickly as possible. I want to take you back to the beginning of the pandemic, when there was an urgent need for masks, for gowns, for gloves. And at that time also, I told you and all Canadians that we were putting in place contracts for the supplies of these goods, and we would issue out these goods to Canadians as soon as we possibly can. We have since procured over 2 billion items of PPE. We climbed that mountain. We then moved on to rapid tests, and we've procured more than 40 million rapid tests for Canadians. The vaccine procurement is occurring now, and we will climb this mountain and we will succeed. But we need to be cautious in terms of receiving Health Canada approval. And we don't want to provide misinformation to Canadians in any way, shape, or form. Thank you. I'll turn it to Dr. Tan on the rest of the question.
So amongst the principles being agreed upon are principles of equity as well, not just the scientific information. And so, but the National Advisory Committee's 4 key groups already encompass some of the populations that you're talking about. So those in long-term care and the elderly and those who work with them, healthcare workers who work with patients who are direct contact, but essential services. So these are not just health services, but other essential services, which could certainly include those who provide food and other essential services. But also the 4th group are those whose working or living conditions put them at higher risk. So people in congregate living situations or congregate work settings and others will be considered some of the first priority groups. And then, of course, as I said, age will then come into play subsequent to that. But those 4 are the key first groups. But even amongst those, we're trying to be much more granular now in terms of as implementation goes along. Well, who's in the first month, say, or thereafter? So that detailed work is being taken very seriously by the provinces and territories as they begin to plan their immunization clinics.
Thank you. We will now turn to the phone for one last question. And in a follow-up, I would ask that we keep answers tight because we are hoping to end not much later than 1. Thank you.
Thank you. Our last question is from Tonda McCharles from Toronto Star. Please go ahead.
Hi, thanks. If I could ask, I'm not sure if this is for who this is for, so I'll just ask. Given the fact that you rolled out rapid tests to the provinces and many were slow to deploy them, could maybe, I'm not sure who, maybe Dr. New, since you're involved in vaccines, or can you talk about the challenges you see ahead for the provinces and to what extent, what will the federal government be in a position to do for some of those provinces who might face some greater logistical challenges, say, than others? So again, I don't know who that goes to.
Well, Tonda, hi, it's Patty. Hi, I'll start, and then maybe I can turn to Dr. New and Dr. Tam for some more specifics. But I'll just say this. It's really important to remember that provinces and territories have a high degree of experience in immunizing people. Yes, there are some novel immunizations coming, Moderna and Pfizer most particularly, that require really cold storage and temperatures and delicate logistics around transportation. But provinces and territories have, every year they undertake a massive immunization program called the Influenza Immunization Program. And in fact, this year, more than 16 million people immunized in a short few weeks. And that just speaks to the fact that they already have systems in place, they already have capacity in place, and they already have processes in place. And so we're building on that to support this process. Not all the vaccines will arrive at one time. And in some way, that's a blessing because we have time to unfold these vaccines, as Dr. Tam said, in an orderly fashion, prioritizing the very beginning those that are prioritized by the advisory committees that we all have. And then, as further vaccines are approved, that we are able to distribute them through more traditional ways. So I think the top line I want Canadians to know is that their provinces and territories already have sophisticated immunization programs, and the federal government is here to help with that, where they're here to help, for example, with these extraordinary vaccines that require extra equipment and new processes, and also any other support that the provinces and territories need along the way, as we've demonstrated throughout the pandemic. We'll be there if they have other glitches or other challenges or other delivery challenges or even other administrative challenges.
This is Tracy Tam. Just to add that, of course, with the establishment of the National Operations Centre and with support from the Canadian Armed Forces, we have, detailed bilateral discussions with each of the provinces and territories, because they're all quite different in terms of their requirements. So there'll be meticulous mapping of the logistics, etc. So I think that the federal government support would be most important for those vaccines that require specialized handling. So that's why that's been put there. But as Minister Hajdu said, the provinces and territories do have significant experience in general with immunization programs and clinics.
And it's Dr. I think the last thing I would add is that we started our first, and I think in a series of sort of technical briefings in terms of the vaccine rollout. There was the one last week that was focused on the regulatory process and procurement, and there's another one scheduled for this week, and it will focus on logistics. So I think we can get into a sort of a more granular detail at that tech briefing. Thank you.
Last quick follow-up.
Yeah, and I guess, want to understand, perhaps for Minister Anand, yesterday, the fiscal update summarized that the federal government to date had spent $13 billion on COVID medical research and vaccines. There was also a reference to having spent $1 billion on vaccines. I'm really not clear on what so far to date, if you're not prepared to release the contracts, have you spent on the 7 contracts that you've, what's the total? If you could give me that, please.
Thanks so much, Tonda. We have invested more than $1 billion so far to secure up to 414 million doses from our 7 vaccine suppliers and to secure Canada's delivery dates early on. We've also invested $284.2 million to bolster our capacity to distribute vaccines. For example, secured freezer capacity at the federal level in order to store 33.5 million doses of the Moderna and Pfizer vaccines falls into that category. So those are the numbers.